This presentation is on human papillomavirus, in short, HPV. HPV is a virus that comes from the papillomavirus family. It causes both cancerous and non-cancerous tumors. Tumors can occur in a number of places, including vagina, vulva, mouth, cervix, and so forth. HPV only affects squamous epithelial cells. These cells are usually found within the surface of the skin and in moist surfaces. There are over 150 strains of HPV. Some strains are asymptomatic, may cause warts or papillomas. Some strains can lead to cancer, and they're high risk versus low risk. HPV can be congenital or acquired. Congenital is when it's present before or at birth. Acquired is when it's developed after birth. Congenital HPV is transmitted from the mother to the infant prenatally or during birth. C-section reduces the risk of transmission but does not completely eliminate the risk of infection of HPV from the mother to the baby. Not all infants who contract HPV present with signs or symptoms, and sometimes they do not show any symptoms even many years after birth. Acquired HPV can be by sexual contact or skin-to-skin contact, but most commonly through sexual contact. HPV can be transmitted through oral, vaginal, and anal sex. A person can be infected with more than one type of HPV. Many times the person does not know they're infected. Partners can pass the disease to each other without knowing, and HPV is the most commonly sexually transmitted infection. People of all ages are at risk for HPV, including children born to mothers who carry the virus, adults engaging in sex with multiple partners, individuals with autoimmune deficiencies, and individuals with chronic acid reflux. There are 5.5 million new cases of sexually transmitted HPV each year. 75 to 80% of adults are affected before turning 50. HPV can cause genital warts, juvenile onset papilloma, adult onset papilloma, cervical cancer, head and neck cancer. Laryngeal papilloma are growths in the throat or on the vocal folds and other surrounding structures. It is caused by HPV virus. It's typically caused by HPV-6 and HPV-11. And there are roughly 20,000 cases of laryngeal papilloma in the United States. 4 out of 100,000 children and 1 out of 100,000 adults have laryngeal papilloma. There's two types of papilloma onset, juvenile and adult. The juvenile onset papilloma affects babies and children before the age of 5 and reoccurs frequently. The adult onset papilloma is less severe reoccurrences and it's more localized. The diagnosis is usually made by reviewing the complete history of the patient and carefully examining their vocal folds with either a flexible laryngoscopy or a video stroboscopy. Symptoms are typically more severe in children than adults. Children may experience relief after they begin puberty. Hoarseness is one of the most common symptoms, especially if the papilloma is blocking the airway. Other symptoms include difficulty breathing and difficulty swallowing. Some of the signs and symptoms of laryngeal papillomas related to voice are the following: rough quality, breathiness, low pitch, strained voice, stridor, weak cry, periods of aphonia where the patient experiences loss of voice, and so forth. Difference between a papilloma in a child compared to an adult papilloma is that in children, the papilloma has a huge impact in the obstruction of their airway. In adults, the laryngeal papilloma causes a change in their vocal quality in addition to the other symptoms discussed earlier. This image shows where a papilloma is located. The papilloma is located on the anterior portion of the left true vocal fold. The papillomas tend to have a wart or raspberry type appearance and can obstruct part of the airway. Here are some different images of the laryngeal papilloma. Treatment requires lesions to be surgically removed. The lesions often come back and require multiple surgeries. Maintaining airway patency is critical. A lot of times, children with history of laryngeal papilloma resolves naturally. The aim of treatment for laryngeal papilloma in children is to keep their airway safe. For those few with severe laryngeal papilloma, tracheotomy may be needed to maintain a safe airway. However, this is quite rare and does not happen often. HPV occurs in 25% of all head and neck squamous cell carcinomas and 45 to 100% of all oropharyngeal squamous cell carcinomas. It most commonly related to strain 16 and occasionally strain 18. Oropharyngeal carcinoma occurs commonly in the oropharynx, which is the tonsils and the back of the tongue. It is usually caused by tobacco and alcohol use. Up to 80% of oropharyngeal cancers are from HPV, and it also occurs in those who smoke as well as those who do not smoke. Esophageal squamous cell carcinoma is the 6th highest cause of death from cancer in the US. It's caused by various things such as alcohol, tobacco, and chemical exposure. According to research, HPV leads to a 3-fold greater chance of esophageal cancer. HPV-related head and neck cancer patients have a better chance of survival, and these tumors also have a lower probability of recurrence. Treatment for head and neck cancer include surgery, excision to remove the tumor, laser technology to treat an early-stage tumor, lymph node dissection, reconstructive or plastic surgery, radiation therapy, chemotherapy, targeted therapy, and so forth. HPV can be prevented with the use of vaccines. Each vaccine is closely studied in clinical trials to determine the number of doses needed. For Gardasil, the series of 3 doses are given over 6 months, and that offers the best protection against certain types of HPV. The Centers for Disease Control and Prevention, CDC, recommends an immunization schedule that includes a 3-dose series for HPV vaccinations. For women, it protects them from 75% cervical cancer, 90% of genital wart cases, 70% of vaginal cancers, and 50% of vulvar cancers. For men, it's them from 90% of genital warts. Vaccinations may also prevent certain head and neck cancers caused by any of these strains. HPV can also be prevented by the use of condoms. Condoms can lower the risk of HPV infection and should be used during sex acts. It lowers the risk of genital warts and cervical cancer, but it does not fully protect against HPV. There is no general HPV test that indicates whether a person is HPV positive or negative. There are HPV screening tests which test specifically for cervical cancer, but there is no approved HPV test that can screen for HPV in the mouth or the throat. Currently, there is no cure for HPV treatment, but there is antiviral drugs available that can block the virus from making copies of itself. Treatment is based on symptoms. For example, genital warts can be removed by a primary care provider or left untreated. The papillomas may be through medication or surgery. Cancers may be treated through a variety of approaches, including surgery, chemotherapy, radiation, and voice therapy is available for individuals whose HPV has created voice-related health problems. The following websites has additional information regarding HPV, and these are all of our references used for this presentation.